We all know what we eat impacts our health, and that has probably never been more important at any other time in American history than now. We have with us the esteemed Dr. James A. Bear from the University of South Carolina. He's a researcher, oncologist, but best known as the creator of the Dietary Inflammatory Index. Now, you have spent the bulk of your career looking at how nutrition and how the foods that we eat impact the human body and impact our health. And there's reason to think that improving your diet in time of crisis is beneficial on a lot of levels, both in terms of helping your body's stress response, immune response. Let's talk about some of the ways that eating better during this crisis can help Americans.
So we know that in order to respond adequately in terms of your immune system, you need to have really good nutritional status. And one of the other things that I'll say, which I think is really relevant to the coronavirus, if you look at the situation in Japan versus the United States, the case fatality rate in Japan is way lower than it is here. And, I look at that and I say, well, it isn't because they weren't infected. They were one of the first countries to be infected. I mean, they're very close to China and Korea. And, there's been a lot of people moving back and forth. The reason why they're not getting sick and dying at the rate that other people are, say in Northern Italy or in the United States or in other places in Europe, is they're thin and they're fit. They're in good shape and their diets are excellent.
And when we say that, of course, we're talking fruits and vegetables are the biggest drivers for all of that. Certainly proteins and beans and everything else we can get, a balanced diet. But there may have never been a more important time for Americans, whether they like fruits and vegetables or not, to start eating them.
There are some exceptions, but in general, the darker, the richer the flavor, the more aromatic, the more anti-inflammatory the food will be. For what we're talking about here, to change the ability to mount that immune response, we're literally talking about hours, not weeks. So, if you drink my masala chai instead of drinking coffee, I like coffee, don't get me wrong, but the masala chai is much more anti-inflammatory. You will feel the effect of it within an hour. And what do I mean by that? You'll feel that you have less joint pain. You'll feel that you have less digestive disturbances. You'll be a little bit more clear-headed. So you'll feel those things right away.
We're hearing reports from all over that people are turning to comfort food, as you would well expect, and there's a record demand for snack foods and chips and things like that. Maybe the best advice for America right now would be resist that temptation, focus on your health, eat the things that you already know are good for you, and focus on those things at the supermarket.
I derive great comfort from eating the Indian food that we just had for lunch here. So for me, having lived in India for 7 years of my life and lived around, Indian food when I was in East Africa and have a lot of Indian friends, for me, Indian food, including masala chai and all the different things that we can cook with those wonderful spices, are themselves comfort food. So I think part of it is just getting people acquainted with different flavors, and this can happen in adulthood.
Dr. Hebert, thank you so much for your time. Thank you for your research. In Tampa, Florida, I'm Chip Carter, and I believe I'm going to go look for some very healthy, brightly colored foods right now.